Hi, Tomislav.
Hi, Peter. How are you?
Always a pleasure to see you.
Always.
I'm fine. You?
I'm fine. Getting better every day.
Let's start. Countryside or city?
City to live in, because things are going on there. You can work. You have a lot of different interests. But maybe to go to countryside, maybe just for a vacation or something. And you?
I prefer the countryside. I have been growing up in a village, and I need to see forest, grassland when I look out of my window.
And which part of your country are you from?
Yeah, I live 80 kilometers east of Dortmund.
I've never been to your town, but I would like to go to Dortmund, because that's one football stadium that I would like to visit the most, the Westfalen Stadium of Borussia.
We hope that Borussia Dortmund is in Champions League again next year.
I also hope so. COVID-19 update. Worldwide deaths have exceeded 100,000. Italy extends limits.
This was a horrible time in April 2020. We didn't have the vaccine, and nobody really knew how to deal with this pandemic. And we have to admit that in the first weeks and months, the European Union underestimated the problem. But in the end, a lot went well to develop a vaccine. Starting in January 2020, and have the approval and the readiness already end of the same year is always like a miracle to me.
Yeah, and I think the first months actually showed us what happens if Europe doesn't step in. So when we had closed borders, when you couldn't get supplies through, this really showed us what happens if we don't act together. And it showed us how interchangeable everything is, how we are mutually interdependent, all the member states, and that we have to work together. I think that's the most important lesson that we learned.
Very important task for us in the European health policy is beating cancer. And I'm very happy that EPP succeeded, making it an issue on the EU politics agenda. And you are responsible for, in my view, the most important piece in the Beating Cancer plan. This is the European Health Data Space. I think it's even more important than the 4 billion euros that we put on the table, because your report will help scientists to do what is necessary to cure future patients.
Before the Europe's Beating Cancer Plan and before COVID, healthcare was a completely marginal topic here, to be perfectly honest. Now this has changed. On the health data space, it's not well known, but it will create enormous difference in terms of how people get healthcare, but also how we develop new medicines and medical technologies. We'll be able to catalog all of this data, all of these data sets which are lying around unused in hospitals, in research institutes, etc. We'll be able to use this, to utilize them, to create new medicines to save lives in Europe. We also protect patients' privacy and patient data, that this cannot be misused, that this cannot be used against their will.
And I always said, the scientists that want to fight cancer, they have a lot of obstacles. We need to give them the red carpet. And your report is part of that. So we make the life easier of those scientists.
One of the main problems that we faced in the last years was of medicine shortage. So during last winter, you remember that we lacked antibiotics, medicines for common diseases, let's say. So what can we do that this doesn't happen in the future?
When people that suffer from cancer, from heart disease, from psychiatric diseases, they go to the pharmacy and they get the message, your medicine is not available. I was called to help in a hospital where I worked as a doctor last year, and then I saw that there were children in that hospital that could go home, but they had to stay in the overcrowded hospital because oral antibiotic was not available. So that has to change, and I think Europe needs to act here. It must be attractive to produce in Europe, and not only the innovative, very expensive medicines, but also basic medicine, which is cheap.
This idea of creating a system where it would be attractive to actually invest, where you would get benefits to invest in Europe, I think this is of utmost importance. We have global alliances forming, which are not always very friendly towards West and towards Europe. So definitely the idea of being less dependent on the others will get more and more important. I think what we are doing also, that we are taking the lead on this, to have a cardiovascular plan in a similar way as we had a beating cancer plan is important. Especially when we speak about prevention of cardiovascular disease, we can do a lot. Because on European level, we have the actual tools. We already have the legislation which addresses issues like eating habits and things like that. We can also fund screening programs, we can work on secondary prevention, etc.
We should do also a systematic plan. And many of the issues are the same, because when you don't smoke, you prevent cancer and you prevent cardiovascular diseases. But there are also specificities, and that's why we should, as it's in our manifesto, make it a priority in Europe. Tomislav, personally, what do you want to do in the next years? So what is your personal plans?
Yeah, I still teach at university, and I would like to continue there to interact with students every week. I think it's very precious. Also, I'm waiting for my son to start going to school, so it's also a new phase which I think is definitely life-changing. And what about you?
I need to take care about my mother. She's old and seriously ill, and I regret that I can't visit her as much as I would want to. And of course I want to spend more time with my wife, with my friends, so to get a bit more relaxed also in the head.
Yeah, I think spending time with family is important, but I have to congratulate you. What you did with the Green Deal, with everything that was put on the table, it's not something that everybody could do, definitely. And I didn't envy you while you were doing this. So, but
nobody should envy.
That's true, yeah.